So even yesterday, I sat with a very young woman that was in a very similar situation, actually, to my good dear friend Kim, that is faced with colon cancer at a very early age, and her chemotherapy is not working as well as we want. And I'm sharing that news with her. And right in that moment, how do we, as clinicians, how do we share bad news? How do we sit with a person when they need it? And as a patient, what do we wish that a person might do? In my mind, I think that looks like sitting down, putting away distractions, including not being on the computer, on my phone, being as honest and kind as I can be in that moment, and then, providing support. And that support looks different on how well I know that patient. It might be, putting my hand on her shoulder and crying with her. It might be if she feels talking about the next steps that I have prepared for her, the support that I'm going to give her. And sometimes it's just sitting together in silence and reminding her that she's not alone. And I think that looks different in different encounters, but that's not something that you can rush through. It's not something you can just say, okay, here's what we're dealing with, and I'm out the door. And I think that deep down, all clinicians wish that they had that type of time, that amount of time. And I'm grateful that I do. I'm grateful that I am in a type of practice where I am, I can allow things to take the time that they need to take.